Before I went into surgery and I was playing, I had heart rates of 135 to 155, and that was all bogus because of the atrial fibrillation and also exhaustion.
I would like to say he's an extraordinary patient in so many different ways and an extraordinary person. He is an example of a multidisciplinary process of evaluation. We collaborate. We each do a piece.
If we can get those people together and talking in a room and about an individual case, then I think the patient comes out with the ability to really make the most informed decision about what option would give them the best result.
There's a lot of discussion about, different choices you can make, but knowing what's going on, I was easily able to help them with the decisions.
We need people who have great amount of expertise and who are willing to cross all kinds of previously uncrossed lines in order to make a team that decides what's the best therapy for the patient, the most efficacious, the least bothersome, and then to carry it out with expertise.
The technology is, a lot of it that they used on me is not very old, and excellent technology.
Research at El Camino Hospital is really exceptional and unique for a community hospital, and we have a history, a legacy of doing that, and because of that has had a dramatic effect on maintaining and improving patient care. At present, there are probably 30 to 40 clinical trials presently going on at El Camino Hospital, enrolling patients and specifically working on both medical device and biopharma cutting-edge technology.
Echocardiography has come a long way in the last 5-10 years in particular. We have the ability to see in 3 dimensions what's going on in real time, and that really gives us a lot of additional information to guide the interventional procedure.
2 years ago, Dr. Jim Joy and I became principal investigators in one of the more interesting trials that's going on in the United States, which is the development of an aortic valve that can be put in through an artery without an incision in the chest at all. We've done about 60 of these cases, and the outcomes here have been very good.
In my case, as a cardiac surgeon, it's an opportunity to be a part of a process of evaluation through which we can make the innovation a meaningful one.
And that's the advantage of it, is it really gives us access and an opportunity of getting the very best of the best and getting access to it early.
The valve program, and I would say the structural heart program at El Camino, is one of the most exciting things about El Camino's current offerings here. We're really out in front of a lot of other institutions across the state, across the country. Relatively few people have the expertise in multiple fields to make this happen. And so I think it's an incredible opportunity for the patients in this area, really in Northern California.
It should become increasingly true for all valve patients that they should come to one place where people can do any therapy that's doable. And right now in Northern California, El Camino Hospital is the only place that can offer just about all the therapies, both surgical and interventional, with a high level of probability of success.
If we didn't have support for research, I think it's safe to say that the quality of care at El Camino Hospital would really be impacted. And that would have a significant impact on the community, just the level of patient care available. And if it were to dry up, the research disappeared, we'd become just a simple community hospital doing simple community health care and really not put us in where we are now, which is in a very unique position as really one of, I think, the leading healthcare providers in the country.
I got back started into table tennis after 2 months, and I've been very healthy all the time.
The idea that you can play even the smallest of roles in helping somebody to enjoy life for longer, not just live it for longer, but to truly enjoy it, it's pretty awesome.
We would like to be able to offer to our community, to our families, to our parents, to our children, the very best healthcare possible.
Those of us that do cardiology and cardiac surgery are interested in caring for people with serious reversible illnesses. Of course, it's difficult sometimes, but the passion is to go there and do battle for them and keep them alive.
I am here at El Camino Hospital because I enjoy working with a group of caring and innovative physicians.
I'm here to do big case surgery as well as it can be done.
Because the people with whom I work every day push me to be the very best version of myself I can be.
Because of the exceptional quality of care that the hospital, the foundation, and the community support.